يا مرحبا زين الشهور.
Assalamu alaikum viewers, welcome to Ramadan and Health, a program that will guide you through the holy month of Ramadan, what you should eat, what you should not eat, what you should do during fasting, and the illnesses you should really be careful of while fasting. Today in this edition, I have with me in the studios Dr. Gaye, who will throw more light on diabetes.
يا مرحبا يا مرحبا.
Diabetes is a condition where your body doesn't produce enough insulin, or it doesn't produce insulin at all. In some occasions, it produces an insulin that may be abnormal, and that affects the regulation of blood sugar levels in your system. And because the blood sugar is not well regulated, the blood sugar goes very high, and that manifests itself by you drinking a lot of water, passing a lot of urine, especially at night, waking up more than 2 or 3 times, passing a lot of urine, and losing weight, and eating a lot, and to the point that you become develop the complications of diabetes, like having abscesses and stuff like that. So the problem of diabetes is that your insulin level is not well regulated, and because of that, your blood sugar level tends to go very high. And because the blood sugar level is very high, then you develop and manifest the signs and symptoms of diabetes. There are 3 types of diabetes. There is type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes affects mainly the children. In those children, the pancreas is totally destroyed. It doesn't produce insulin, so they will need an injection of insulin to save their life. They need it for survival. Type 2 diabetes is a condition where people tend to be overweight. They are more than 35 years old, and their body produces insulin, but it's not enough to regulate the sugar. So, and type 3 or gestational diabetes is a diabetes that occurs only in pregnant women, and when you deliver, it actually disappears. Recent studies have shown that 50% of women who develop gestational diabetes go on later in life to develop the type 2 diabetes. That is diabetes that happens after 35, and it's because you don't produce too much insulin. Let me make a generic statement, and that is, according to the textbook, most or even all diabetes patients should not fast. Let me start with type 1 diabetes. In type 1 diabetes, the problem is the body doesn't have insulin at all, doesn't produce. So those children need to inject themselves almost every 4 to 6 hours. Otherwise, the blood sugar goes very high, and they may have conditions like ketoacidosis. They go unconscious, they go into coma. We don't want that to happen. So for people with type 1 diabetes, generally they should not fast. However, with modern insulins that are available, there are long-acting basal insulins which you inject at night. They are released slowly into your blood, and they can regulate the blood sugars while fasting. For those children on those special insulins, they can fast because the insulin doesn't get too high. The blood sugar doesn't get too high. It plateaus after a particular level and doesn't get high at all. And when you don't eat, it really doesn't get higher or lower. It stays within normal limits. In type 2 diabetes, this is the diabetes that affect people after the age of 35. More often than not, they are overweight. They're usually women. And what we advise them, their blood sugar is controlled in 3 ways. To control their diet, to exercise, and then to lose weight. Then what we try to achieve is a critical level for these people. So one of the things we ask them to do is we ask them to regulate what they eat. Some people are only on that, or they are on dietary regime. Those people can attempt to fast, but if they see themselves developing complications, they should break their fast. There are those who are on medications, and they take tablets called metformin. Metformin regulates blood sugar, but it doesn't lower blood sugar. If somebody is on metformin alone, he or she can venture into fasting, but the time and manner in which he takes the medication has to be altered, and it has to be specific. I don't want to give a regime on the television because people would take it as the gospel truth. What you need to do is you go to your own doctor, your regime of metformin will be altered. But generally speaking, what they should do is they should take their metformin at the time of breaking of fast, at dusk. And the other time they should take the second dose of metformin or the last dose of metformin is before they go to bed, not early in the morning. It's recommended that by the time you start the fasting at dawn, you shouldn't take any of the diabetic medication. And there's a third category of type 2 diabetics who are also on insulin. They should be treated like the children. Most of them are on basal insulin, and normally, if it's not Ramadan, we ask them to take it at 10 p.m., their insulin. What they should do is they should take it earlier when they're breaking their fast, and they must make sure that they wake up early in the morning and have some meal. If they do not, because that's the time the insulin starts acting, their blood sugar will go down low and they will go into hypoglycemia. Hypoglycemia simply means low blood sugar. And the way they will know that their blood sugar is low is that they will be confused, they will start sweating, they will start shaking, and from there they will start forgetting and start falling down and then become unconscious. And sometimes some people die. People on tablets and have not eaten, usually the tablet works, they have maximum effect around 6 p.m. And you notice in most clinics, people who are fasting tend to be rushed after their 5 o'clock prayers to the hospital. So there's a tablet called glibenclamide that lowers your blood sugar. If you can avoid it once you're diabetic, you may be able to go to Ramadan. If you do all this and still realize that you can't fast, my honest advice to people is please do not fast. But I would encourage them to eat a lot of fruits and a lot of vegetables when they break fast. When you break fast as a diabetic, you should eat normal sugar, because that is where the energy comes from. The artificial sweetness do not give you the energy that you need after breaking your fast. And a diabetic patient, generally people who are not even diabetic, should not spend a lot of time under the sun. Because once you do that, water is drawn out of your system and you become dehydrated. If your blood sugar is high, the sugar actually also draws water as well into the blood. So you will have two effects of drawing blood that will draw the blood. One is the sun and the other is the sugar. And you feel weaker generally than the one without diabetes.
Thank you so much for joining us. That was Dr. Gaye giving us an overview of diabetes and Ramadan. Well, join us next week, inshallah, for another topic in this program of Ramadan and Health. Till we come your way next week. Salam.
يا مرحبا زين الشهور